Hello friends, welcome to TECHQUEST channel. This is for the medical technologist by URTech. In this video, we will discuss about disseminated intravascular coagulation lab diagnosis. The short form is DIC. Disseminated means blood clots throughout the body blocking small blood vessels. Intravascular means clot inside the blood vessels. Coagulation means formation of clots. Let's discuss about normal mechanism of blood clotting, abnormality in DIC, the etiology of DIC, signs and symptoms in DIC, essential workup in the lab, the list of lab tests. Mechanism of blood clotting. The balance between blood clotting and excessive bleeding involves numerous factors. These include the cells lining the blood vessels, the platelets, and numerous coagulation factors present in the circulation as enzymes, substrates, inhibitors, and plasma proteins. When damage occurs to a blood vessel, the endothelial cell lining of the artery, vein, or capillary is disrupted. First response is to constrict the damaged blood vessels and other vessels to limiting the blood flow to that area so that platelet aggregation can begin. The platelets in the area change shape and begin to adhere tightly to one another to form a weak platelet plugs. The platelets release labile factor along with vitamin K to start the formation of permanent fibrin clot. We always think of bleeding and the coagulation mechanism in bleeding conditions. These fibrin clots must be dissolved for a normal flow of blood circulation. When the damaged blood vessels are repaired and they become normal, the fibrinolytic system is activated and the clot is dissolved. What happens in disseminated intravascular coagulation? There are many conditions stimulates the production of fibrin clot at multiple locations in circulatory systems. The platelets and the coagulation factors are used up for these clot formation. So there is shortage of platelets and coagulation factors that cannot stop the bleeding in the blood vessels and in major organs like lungs, liver, and brain. The amount of fibrinolytic factors are also low that body cannot lyse the fibrin clots. What are the conditions that can cause DIC? The systemic infection with bacteria or fungal. The toxins produced by these organisms can stimulate the coagulation. Severe trauma, burns, hyperthermia can cause DIC. The cell injury can increase the release of van Willebrand factor that can stimulate the coagulation cascade. Solid tumors or hematological cancers can stimulate DIC. The placental abrasion or amniotic fluid emboli can also induce the DIC. Aortic aneurysm and other vascular disorders, thrombocytic thrombocytopenic purpura, idiopathic thrombocytopenic purpura, transfusion reactions, massive transfusions, allergic or toxic reactions. The snake venom can cause DIC. Coagulation system activation results in systemic circulation of thrombin and plasmin. Role of thrombin in DIC. Thrombin circulates and converts fibrinogen to fibrin as monomer. Fibrin monomer polymerizes into fibrin clot in the circulation. Clots cause microvascular and macrovascular thrombosis with resultant peripheral ischemia and end organ damage. Platelets become trapped in clot with resultant thrombocytopenia. Role of plasmin in DIC. Plasmin circulates systemically, converting fibrinogen into fibrinogen degradation products, the FDPs. FDP combined with fibrin monomer. FDP monomer complex interfere with normal polymerization and impair hemostasis. FDP also interfere with platelet functions. Acute DIC is also called uncompensated form of DIC. Clotting factors used more rapidly than body can replace them. Hemorrhage is the predominant clinical feature that overshadows ongoing thrombosis. Chronic DIC, also called compensated form, body able to keep up with the pace of clotting factors consumption. Thrombosis, predominant clinical feature. Diagnosis. The signs and symptoms: excessive bleeding, pedicare, purpura, hemorrhagic bullae, wound bleeding, epitoxis, gastrointestinal bleeding, excessive thrombosis, large vessels, microvascular thrombosis, and end organ dysfunction. Pulmonary embolus, non-bacterial thrombotic endocarditis, gangrene, ischemic infarcts of kidney, liver, central nervous system, and bowel. Lab diagnosis, platelet count. As more clots are formed in the body, platelets are trapped in the clot, so the platelet count is decreased below 1 lakh per cubic millimeter. Platelet count may be normal in chronic DICs. Prothrombin time. Prothrombin time or prothrombin ratio and international normalized ratio, the INR, is an assay for evaluating the extrinsic pathway and common pathway of coagulation. The reference range depends on the method used, but it is usually 12 to 14 seconds, and the INR in absence of anticoagulation therapy is 0.8 to 1.2. In DIC, the PT is prolonged, reflects the underlying consumption and impaired synthesis of coagulation cascade. Fibrinogen degradation product, FDP, also called fibrin split products, are components of the blood produced by clot degeneration. As the cut heals, the clotting slows down. The clot is broken down and dissolved by plasmin. These dissolved fragments are fibrinogen degradation products. D-dimer is a fibrinogen degradation product, contains 2 D fragments of the fibrin protein joined by a cross-linked appear in the blood after fibrinolysis. Reference range for non-pregnant adults less than 0.5 milligrams per liter. D-dimers are not normally present in the human blood plasma except when the coagulation system has been activated. High levels of fibrinogen degradation products are found in DIC, indicating the intense fibrinolytic activity stimulated by the presence of fibrin in the circulation. Fibrinogen level. Fibrinogen, the factor 1, is a glycoprotein complex produced in the liver. During blood clotting, thrombin attacks fibrinogen to form individual fibrin strands plus 2 small polypeptide. The individual fibrin strands then polymerize and they are cross-linked with other fibrin strands by blood factor 13 activation to form a mature fibrin clot. Fibrinogen is a positive acute phase protein. Its blood levels rise in response to systemic inflammation, tissue injury, and in various cancers. A low level is more consistent with the consumption process of DIC. The International Society on Thrombosis and Hemostasis has developed a DIC scoring algorithm for use in patients with underlying disorders. APTT levels are decreased, indicating the consumption of coagulation cascade in DIC. The peripheral smear may show fragmented RBCs due to shear stress from thrombi. Elevated blood urea nitrogen and creatinine may be noted, indicating the renal insufficiency. Treatment with blood products. Fresh frozen plasma. For prolonged PT, fresh frozen plasma provides clotting factors and volume replacement. Platelets. Platelets are transfused when the platelet count is less than 20,000 cells per cubic millimeter or for less than 50,000 with ongoing bleeding. Cryoprecipitate. Cryoprecipitate contains higher fibrinogen content than whole plasma. Lost packed cells are transfused when the patient becomes anemic due to bleeding. Thank you. Thanks for watching.